See, that's what I'm saying about you're a special guy, that you got to be tense all the time. The same thing with a policeman, you know. When I was on patrol, and it's tension, you're driving, all of a sudden, car number 8, as soon as that, I get, what is it, you know, car, child hit, Marshall DeKalb Street, you know, and your adrenaline starts moving. So you got to get yourself together. Oh my, go ahead.
Well, fortunately, they very rarely get into trouble and need to call us emergently. But what he was mentioning, I think, is how we collaborate now. And in the current era, I think collaboration is like never before. We work together very closely with respect to looking at a patient, deciding what the right thing to do is, deciding whether or not we can each do something that maybe we can optimize or give the patient the best possible product, so to speak, which combines something that I do along with something that he does. And hopefully we can avoid often the major open heart surgery, and he can do a percutaneous or the needle puncture and fix something, and then I can do a less invasive cardiac surgery procedure such that we can, completely solve the patient's problem with what I view as really the 21st century type of intervention.
Well, now, Doctor, never did this at Montgomery Hospital, right?
Well, we had, when somebody came in with an acute heart attack, we had the emergency intervention to do the stent and open up the culprit artery.
At Montgomery Hospital?
We could do that at Montgomery, and we could do them semi-electively, but we didn't have remotely the type of things that we now have available. For example, I had a patient who had a blockage that was best taken care of surgically rather than with a catheter technique, and it was a single blockage in the front of the heart, more or less in this artery here, the left anterior descending, and Dr. Anderson, I'm bragging for him, was able to go in, make an incision this big between the man's ribs, not through the breastbone, take down an artery from under the chest, attach it over the blockage, and the guy's back to work in a few weeks. He was out of the hospital in about 4 days. It used to be people had big incisions from here to here, and of course some of them still do need those big incisions, and would be feeling pretty lousy for 4 to 6 weeks until the wounds all healed up and they got their energy back, and probably wouldn't get back to work for a few more months. And it's for me, having been in practice 34 years, it's sort of miraculous what these guys can do, respectively, for my patients. I basically feel like I'm the quarterback, and I just toss in the ball. And some of the stuff I manage, just giving medications and cardiac rehab and exercise and diet and doing the diagnostic testing and the following along is my role in it. And then when there's something or other is occurring that I can't deal with just my prescription pad or dietary changes or exercising, I've got tremendous ammunition sitting here, as Hank just said, in the bullpen.
What's this little trapdoor here? Doc, you're the guy that has to open them. What's the scoop on that?
Well, this is something, and maybe Dr. Velasco or McGargy can talk about it. This is the right atrium. The 4 chambers of the heart being the right atrium, right ventricle, left atrium, left ventricle. The atria are really the chambers where on the right side the blood comes in from your upper body and lower body into the right atrium. And then it goes through the right ventricle into the lungs where the oxygen is added, and then it comes back into the heart to the left atrium and into the left ventricle, which is the main pumping chamber, and then out to the body. So this structure here is known as the auricle or the appendage, and there's one on both sides, and they're interesting because they really don't serve much of a function, actually. But they can cause problems, or the atria can cause problems, primarily when we have an irregular rhythm. And the most common one is known as atrial fibrillation.
What do you mean by what's that? It's not hitting on all cylinders.
Well, it's just like a quivering, as opposed to the normal contraction that we have of a normal sinus rhythm. Atrial fibrillation is when you get this kind of chaotic rhythm. Right. Or contraction of the atrium. And it's a very common condition in people, and I think there's a lot of new things to treat atrial fibrillation and try to get people back into sinus rhythm, and some of them are being done at Montgomery Hospital. A lot of them are being done with some of Dr. McGargy and Velasco's partners in terms of using energy sources and ways to actually map the heart and find where the source of this irregular rhythm is coming from, and making it go away and getting patients back into sinus rhythm. So I like to think of the new hospital that we have here as I'd like to make it into one big cardiac center, but I really think it is now a cardiac center in that we have very advanced interventional cardiology, advanced cardiac surgery, electrophysiology, regular cardiology. So I think that there's, as Dr. Velasco said earlier, there's no reason that really almost any cardiac condition can be treated there.
But I saw in the Philadelphia Inquirer where Einstein has 2 or 3 hospitals, right? In Philly, and Montgomery Montgomery Einstein here has the highest rating. So we're doing very successful as a new hospital coming on. And that means because people like you are making this, being successful in the area, and people feel confident to come to this hospital. And so now, tell me something about yourself. You wasn't born a doctor. I wasn't born a police officer, right? Tell me something about you. What makes a heart doctor?
Well, I always say it's because my mother told me I was going to be one. No, I honestly, I always wanted to be a doctor. I can't imagine ever.
What did you do?
I never wanted to be anything else.
Did you play a doctor, cutting things up, or what?
I don't know. Maybe it was watching Medical Center or the Marcus Welby, which is you remember. So I don't know. But honestly, it was always something.
Anybody in your family doctors?
I have some. Yes, I have some relatives, not in my close family, but some of my relatives are physicians.
And so what kind of training did you get? To be
a
heart doctor?
Same. We've all did essentially the same thing, meaning we went all the way up through college to medical school. Then we did residencies in medicine, in cardiology, and then we did specialty training in interventional cardiology. I did cardiac surgery. And a lot of this spanned many years after we left medical school to get to where we are now. But interestingly, I had a mentor of mine, a surgeon, and one day we were going in to operate on the patient, and the patient said, you're not going to let this to the chief of surgery. You're not going to let the student operate on me. And he took her hand and said, "My dear, we're all students." Meaning that we continue to learn new techniques and new technologies and how to treat people. Still, we continue to evolve as physicians. And one of the nice things, again, at Montgomery is we've been able to bring in all the new technologies, all the physicians there. One of the reasons why I think it's rated so high is because you have a great population of physicians, well-trained, highly skilled, with new technologies there.
So part of the team. Tell me something about you now.
I grew up in a doctor family.
Oh, yeah?
Yeah, my dad was a doctor.
What kind of doctor?
Pathologist.
What's that? Baby doctor?
No, autopsies. Dead people.
Oh, my God.
Yeah, so he worked...
We're talk about the dead.
well, with that in mind, sort of broke the ice a little. And then I had an experience growing up that really hooked me, and that was my dad was drafted, and we lived on an Army base.
Where?
Fort Sam Houston, and then we lived on an Army base in Missouri, Fort Leonard Wood.
Yeah, we're
in
President Truman, right?
Right, middle of nowhere.
I was down there. It's Independence, Missouri. Man, you ever get the chance to see his museum there?
The Show Me State. So
great guy.
My brothers and I were out in a field catching snakes. And the snake bit my brother. He handed it to me. It bit me. Our hands swelled up. And we were like, uh-oh, 12-year-old boy, this can't be good. Put the snake in the bucket, brought it back home. My mom couldn't believe we brought the snake home. She drove us up to the little hospital on the Army base. And the The medic asks what happened. We said, the snake bit us. He goes, where's the snake? We show him the snake in the bucket. He goes, oh, that's a copperhead.
Oh my God.
So poisonous snake. And then at that time, they gave us anti-venom shots. And so I never got sick from the poisonous snake.
And you caught it in time.
Yeah, they caught it in time.
Well, what did they do? You're supposed to get it, suck it out or something? That's what I see that. I see
don't
the
know.
cowboys to do that.
I don't know, but it just really intrigued me that they could just have the antidote and fix the problem.
Just have it right there. Yeah.
Yeah.
I remember there was a case here in Norristown where a guy that owned a bar there on Brown Street, and about 2 o'clock in the morning, they had a couple of drinks on it, I guess, and they went down to the zoo in Norristown. They put his hands in the cage, and I think the bear bit him. And next thing you know, he would start cutting, and they were looking all over for some kind of medicine stuff. Finally, they got it from Chicago or something. They sent it, and they cut the arm up to here until they would get the whatever kind of medicine to stop it. See?
Wow.
But you were lucky then, right?
Very lucky, yeah.
Right.
But that's sort of what hooked me into being intrigued with medicine.
How about your family? Tell me, your dad's still around?
No. Cancer unfortunately took him 4.5, 5 years ago now.
Oh, yeah?
So, yeah.
Yeah, you know, Doc here, when I had this pacemaker here, then they looked at it and there was sort of an infection around the side, and he says, well, we're going to try to save it by medicine, but it didn't work. He says if the infection is below the pacemaker, then you got a problem. So thank God they got it, looked at it, and the infection was around the outside. It wasn't underneath. And then so they got it and they put it over here. So last 2 weeks ago, I went over to get checked out for a pacemaker with Dr. Tim and the girl, and the girl put it over here, and she says, oh, I get excited, and found out that this was the old place. She was looking here. I couldn't find no pacemaker. It was over here, you know, but it was really good. But, you know, we've been here for a half hour. We talked about, I think we covered just about everything. Is there anything you want to just mention? We're closing up this couple minutes.
I just think it's very gratifying now to have the opportunity for me, when my patients need to have these interventions done, that they're done right here in town. I don't have to send them out of town. I get to participate in their care after the surgery, not during the surgery, but certainly after, and be involved in their care right from the beginning without having to just basically farm them out to another institution like we'd had to do for most of my 35 years. So I'm just unbelievably excited about what we have available now right here.
Thank you. How about you? A couple closing remarks.
I think that it's exciting to have cutting-edge technology at your fingertips. And my job and Dr. Anderson's job, we like our toys, and this institution has supplied us with the best new tools that we need to do the best job in complicated situations to fix hearts. So it's very exciting having all those tools in the box. Yeah.
Well, Doctor?
From my perspective, it's great to be part of this team. It's a collaborative thing between us and cardiology and interventional cardiology, and we're able to take care of patients now that historically were sent home. We're talking about older patients now, 80-year-olds, 90-year-olds. We're able to fix them, to give them, to improve their quality of life, improve their survival. So to me, it's just very gratifying to be a part of this team, to be able to collaborate, and to be able to do it in the new facility that we have. It's been very exciting.
Well, let me tell you, this half hour is really good. And then I was telling you about some of the songs here. Peg of My Heart, Who's Sorry Now, Baby Face, My Poor Heart is Jumping, You Sure Started Something. So all these here songs about the heart. So have a heart, and I'm sure we all got a heart, right? That's like the guy says, when you're driving home, make sure you have a car. Oh, well, that's a Social Security joke. You'll get it when you're 65. Okay, ladies and gentlemen, thanks a lot for allowing us to come into your home, and I hope that this program enlightened you about what we have available and the people that we have that are here to help us. Einstein Medical Center, Montgomery, okay? So until we meet again, keep bobbing and weaving, keep your trunks off the canvas, and God bless each and every one. And as Lawrence Welks would say, keep a song in your heart. And Hank Cisco says,